Gina, I think you need to unmute. Yes. You're mute even now. Not audible. I think you can take some support.
Hello. Hello.
As you are audible.
I'm audible, right, sir?
Yes, yes.
Okay. Uh, One second. Yeah. Good afternoon, everybody. So sorry for the inconvenience. There is a problem in the technical issue. So thank you so much for your patience. I welcome you all to the eighth webinar series of Vayomanasa Sanjeevani. So today we have Dr. Sojan Antoni. Uh, we have Dr. Sojan Antoni to talk about Let's Stand Against Elderly Abuse. On to you, sir.
Thank you, Gina. Just I wish to share my screen. I'll share my screen so there will be a PowerPoint and I'll be 1 second. Gina, is it visible PowerPoint?
Yes, Sojan.
Thank you, sir.
Yes, sir.
Thank you. So thank you so much for inviting me to this program, Vayomanasa Sanjeevani. This is a series of webinars with us. Professor P.T. Shivkumar sir is with us, and also Dr. Preeti Sinha also will be joining with us, who is the host for today's session. So today it's a very interesting topic for the welfare of senior citizen, and it is more of a social in nature. So the topic is titled as "Let's Stand Against Elder Abuse." As we know that elder abuse is a common thing, which many times underreported, and people who are victims do not get the services what they deserve. So the World Health Organization actually has brought a very good fact sheet about elder abuse. So today's my presentation will be structuring around that. Around 20 to 30 minutes, I will be presenting the ideas. Then we'll be having question answer where we will try to address certain issues like where to report, what can be done, and suppose in such situation, what is the role of healthcare sector, social welfare sector, senior citizen forums, what they can do. All those things we can discuss subsequently. Let's understand this concept, elder abuse. Is it a hidden problem? Yes, elder abuse is a hidden problem. See, in our as a country, culturally, we respect our elders, we respect our parents like gods. That's our cultural value. But we know that over the period, because of various social and cultural changes, society also has lost certain values. Maybe one of the value is respecting elderly, listening elderly, or giving importance for elderly. So sometimes it is challenged. So World Health Organization has estimated that 1 in 6 older adults above 60 worldwide have been abused in past years. It means that it's not a very rare phenomena. So who are in 6 members, one person might have been a victim of elder abuse. How it has been defined? So, elder abuse is defined as a kind of abuse or neglect of older people. It can be in different forms. One of the most common form may be, I don't call it physical abuse is the most common form, maybe psychological or emotional abuse, like insulting them, threatening them, humiliating them, controlling their certain behavior, confinement, and isolating them from the mainstream of the society. So this form of abuse might have been faced by many of our elders whom we know. And similarly, physical abuse also, we cannot say that it's not a rare phenomena, like hitting, pushing, kicking, inappropriate use of drugs, or the say no restraining them into bed, or locking them inside the house and all. So physical abuse is another form of abuse. Of course, we have read many newspaper articles like sexual abuse against the elderly living alone, or the elderly women, and it is not very rare things. We keep hearing such news also. Financial exploitation is another major exploitation which older adults they experience, like misusing their funds which they have saved, or misusing the property what they have, or misusing the whatever pension what they get. It is sad to notice that sometimes the old age pension, which is some in some places is 500 rupees or 1000 rupees, that's taken by the adult children for their using some alcohol or tobacco products, or just they take and they don't give the proper care. So across the social strata, we cannot say elder abuse is common only among people from low socioeconomic status. It can be, it is there everywhere, be it educated or uneducated, from low socioeconomic or middle socioeconomic, everybody in our society, we can see that it's common. People need to be aware about that. So I have seen that, especially people who work in private sector or in the public sector, when they retire, they get some fund. Usually they put money in bank and they try to get some interest. Sometimes what happens is the children, grandchildren, or friends or non people, they convince the older adults like better not to put in banks. Banks may give very less interest rate. They take that money and they never return. They give some kind of interest for initially, gradually they just ignore or neglect. Many times the older adults, they will be in a dilemma. So sometimes they may not disclose to even their own children or grandchildren, or if one child is involved, another child, they're scared to report, or they're worried, how the person who involved will react. So financial exploitation is quite common, and many times they don't seek justice. Their rights are denied. And the other thing is neglect or abandonment. So not providing food, housing, medical care, and all. This is also common. Not providing their, especially food, they may provide housing, they may provide medical care. Many times the medical needs of elderly are not addressed, maybe because of various reasons, but still it's a neglect, is an abuse. And you know that due to the migration, I mean, even in rural area, across migration is a common phenomenon across India. So what happens when children migrate? Maybe unknowingly they may be doing, like, they neglect the needs of elderly. They do not give proper attention. So that's also comes under elder abuse. So elder abuse can just once or repeatedly. It can happen by family members. Sometimes people are institutionalized, like if they're in old age home, by the staff of old age home, so they can commit the elder abuse. Quite often, people whom they trust, the trust is misused, or the trust is becomes a reason. Like, I trust my son, I trust that he will take care of me, and I give my entire property, and he doesn't take care of me. Or I trust my daughter and I give everything, and I take a lot of loans for their education, and they support a lot for their career settlement. Finally, they don't support back. So they neglect, they take away the financial things, they simply ignore. So all these things will come under elder abuse. So in such cases, so if you see the definition, what we have seen, like physical abuse, psychological or emotional abuse, sexual abuse, financial exploitation, neglect or abandonment, you all can reflect. Those who are participating can reflect. How many of six elderly are already present in this group? How many of us have already faced this kind of issues? Or how many of us have witnessed such abuse in our own relatives, in our own, among our neighbors, or in our same apartment or same place? So it's an issue now. So it's a common issue. So there's a statistics says these are the statistics from World Health Organization. It means that it's not only from India, across globe. A common statistics, if you see, 90% of all abusers are family members. Means 9 out of 10 people who abuse elder people, they are family members. Most abusers are adults, children, their own spouses or partners. Here comes an important issue. What happens in relationship? So that's the issue I think we need to discuss later also. I think I'll take the help of all the panelists also. Many times we do not understand the needs of older people, and older people also will struggle to meet their needs. In this misunderstanding, miscommunication, there comes a lot of frustrations and friction. For example, a person who is living with a dementia, or means memory problem, may not understand, may not learn what we are telling. And many times we think, why he can't adjust, why she can't adjust, why can't simply they do that? I asked my mother, please don't do anything. So why she is going outside, why she is doing that? I asked my mother, don't cook, and you may harm yourself and others, but she doesn't do it, then I will lock her inside. So many times certain set of behaviors of senior citizens or older people, it is not understood by their children, adult caregivers. There comes, sometimes unknowingly people commit elder abuse. Elder abuse also can happen in the old age homes and the nursing homes, even hospitals. I remember one of the hospital staff was sharing. It's an older adult who was admitted in the hospital. The person was repeatedly calling nursing staff for a lot of for clarifications. Finally, the nursing staff started to shout at the person, "Why are you ringing the bell again and again? You are disturbing me. Don't you have manners? Please don't disturb. If you do like this, no, how will I finish my job?" So there comes a person who is anxious and who needs reassurance. And if people do not know how to handle it, definitely instead of addressing a core issue of anxiety, people can get irritated and they can do physical or the emotional abuse. So elder abuse also can happen in institutions, and some studies have reported that in institutions, no, 36 percentage of people who witness physical abuse, 10 percentage of they themselves are confessing that yes, we have done the physical abuse. 40 percentage of them have agreed that the old age home staff or such staff agreed that they have done the psychological abuse. Now, see, only 4 percentage people have reported this abuse. Why? Because the one thing, major reason is fear. Suppose if I report this issue to the police or the any kind of helpline, what will happen to me? Will I be rejected? Will I be excluded? Will I be thrown out of family? The fear itself can no cause can actually prevent them reporting. Sometimes worry about getting the abuser in trouble. For example, I have dedicated my entire life for my children, so I do not want my child to suffer further. So I know that I have dedicated my life for my children or grandchildren to enjoy. Suppose if I file a petition or an FIR, so what older person thinks that no, that may affect the prospects for that people. So I don't want to complain. So sometimes that worry about the how it will affect the abuser. And sometimes the people may not be mentally capable. So as I was telling that the persons who are having a memory problem or a dementia, Alzheimer's disease, or people who are mental health problem, physically not fit, all those things can make them mentally vulnerable to silently suffer this abuse. And sometimes maybe feeling ashamed or embarrassed, no, sometimes family values will be there. So I am so and so family, I don't want to report because it affects the name and fame of the family. So just keep silently suffer. In many countries, older people have nowhere to turn for help because there are limited systems to address the elder abuse. So that's another reason why people are not reporting, because there is no proper system to take care of this kind of complaints. What happens, what are the risk, who all are what are the risk factors for committing elder abuse? One common thing, as all of you are aware, that if you are the significant caregiver, if has a habit of using alcohol or drugs, then their ability to take judgment, take decisions will be clouded, and they may not be able to take proper decisions. And for a single reason, they can get irritated and physically or verbally abused. So there comes as a scope is also there here. If your children are affected by, if the older person's children are affected by alcohol, if we can help them to get treatment for alcohol or drug dependence, that itself will reduce the risk. High stress levels, that's another common thing. We might have recently seen, we have seen a few studies also. The domestic violence increased during the COVID-19 pandemic. What is the reason? The stress level is very high because the demands are more, resources are less, people are struggling to cope up with, people are frustrated, they do not have enough resources and skills to handle the current crisis or ongoing job loss, issues in family, issues related to financial aspects, the high stress level. Actually, the people, the caregivers are vulnerable to become abusive. Another major reason is can be lack of social support. I'm the only person is available to take care of my parents. And then what happens? The caregivers also may not be having support. The other way, not having anybody in the family. There are many older people, they live alone in community. So then what happens, neighbors and people who engage and social activities and all can abuse the reason just because they do not have enough social support. So one of the key variable in handling that stand against the elder abuse is how can we enhance the social support system for older adults who are living in the community. It can be from their own family members can support, friends, relatives can support, or government systems can come in and support, like police can support, self-help groups can come in, a local panchayat or local body representatives can be part of that, or the social welfare department can have a lot of initiatives, can be part of a lot of voluntary organizations can pitch in and help. Another issue is emotional or financial dependence on the older person. It happens sometimes, that if the older person is the source of income for the family, that there is a chance for frictions and fights and all. Lack of training on in how to care for older people. Here comes the importance of Vayomanasa Sanjeevani, our pet project from our NIMHANS. It is coming up very well. We need to tell people how to care older people. Many people are unaware about the needs of older people, how to communicate with them, how to convince them, how to how to handle the situations which can escalate to the physical or verbal abuse. Sometimes what happens is older people also can abuse the younger people, like the caregivers, like blaming, comparing, and all those things. Then the younger persons or the people who provide the care has to understand a person in context, an aging person with lots of problems, limitations in memory, problem solving ability, understanding skills. They may be struggling to properly interact with the younger population who can actually understand the context if they are provided training. So training is the one thing is missing. Like that in many places now you might have seen lots of books on how to do parenting, the young children, adolescent children. There is a need how to care older people. There's a need to have such kind of reading materials, and that will help us to promote the dignity and rights of senior citizens. And depression, as you know that no, the prevalence of mental illness in India, last national mental health survey says that almost 16 percentage of people, means 1 in 6, in the US they have the proper statistics, they say that 1 in 5 they suffer some kind of mental illness during the course of life. So India is also not very behind. So 1 in 6 people can behave differently because of their mental health problems. These are the problems can be treated if caregiver of an older person is hitting because of the depression, because of psychiatric problem. It can be treated, and then they will be able to provide better care for the older person. So, what are the risk factors for suffering the elder abuse? Older people with dementia. That's what already I told. 2 out of 3. So statistics shows so very high number, right? 2 out of 3 people with dementia have been abused. What is the reason? I do not want to abuse or misbehave with my father. But when I see strange behavior of my father, I don't know what to do. Then what would I do? I may so my father goes outside without permission. What I will do? I may try to lock him. So if he resists, I'll pull him, and if he demands so much, shouts, I'll go and try to threaten him. If you don't keep quiet now, we'll put you in old age home. So see, many times elder abuse happens in a context where the caregivers who are otherwise very nice people, they want to care, they want to love their parents, provide the best service or gratitude back to parents, but just because of their missing the knowledge what to do in certain situations. They may be lacking the knowledge, and then they, without knowing, without no options, sometimes people can be aggressive towards people who are suffering the dementia and all. So sometimes purposefully also, that is another context we should understand. We have seen in NIMHANS many cases when a father or mother is likely to develop severe dementia. Some children, one or two children, they join together and they snatch the property from without knowledge of other children. That's also, so that's almost a crime. Many times children, they do without knowing the fact that they're committing a crime. It's a punishable crime if they do such kind of cheating. It comes to the offense of a cheating or violating the rights of senior citizen. So what happens if I do this kind of things, or what happens? How does it affect on the older people? Basically, injuries, especially if it's a physical abuse and all, it can cause injuries, and it can create disability. Especially, they will be very fragile if you push and all. There's chance that they may have a head injury, or the injury, the hip injury, and then they can be, develop the disability, and health conditions can become worse. And above all, physical health problems, psychological effects like anxiety, feeling terrible loneliness, loss of dignity, trust, and hope. They will be very dull. Sometimes when we see such people, they may lose entire hope because they have trust on their children, grandchildren, spouse. One fine day they realize that there's nobody whom to trust, and their brain will be such a state that they don't want to experiment anymore, and they do not want to relate anymore. They may socially disengage. There's a popular theory is also there: social disengagement. Stop doing anything, simply withdraw and just say that I want to die, I'm waiting for the death. So this can be also a symptom or a sign where people may be suffering silently. And abuse, yeah, the death is another major thing. Victims of elder abuse were twice as likely to die compared to older people who do not report abuse. So is it preventable? Can we prevent elder abuse? Yes, we can help no ensure the older people live in a safe environment without fear of being hurt, exploited, neglected. What public can do, we need to be very careful. We need to see the signs of elder abuse. One of the sign I have already told: they simply withdraw, they don't interact, feel lonely, feel very anxious, they'll be depressed. And in the same one, the same physical injury. If some of the elderly, if you observe injury, you can ask what happened. So you can ask, they may share. If you spend some time, they will tell. So watch for signs of elder abuse, and learn how to help, and also report abuse. Many times, even if you have noticed, especially like us, we are working in a hospital sector, when we see the such kind of abuse, we need to report. Whom to report? Definitely, we are going to tell about that further in the coming presentations and slides, or in the discussion. Older people can. What older people can do, if I am a senior citizen, how can I prevent elder abuse? Be connected to family and friends, because when you are connected, it's like electricity, like a mobile. We need to recharge, right? We will be connected, we'll be connecting it with the electricity. Same way, if you are socially connected, like family and friends, you have some kind of safety net. There is a famous one of the YouTube video which I could see accidentally. They were telling that socially active individuals are going to have a long life. Like, their longevity will be more, their life expectancy will be more, because once you are socially active, you'll be physically active. Once you are having socially active, physically active, you will be having enough social support, and you'll be having a sense of purpose in life. So that will create a lot of energy, and you'll be knowing the rights, and learn more about their rights. Many older people are there unaware that their rights. This is some example of the developed country, Older people have still right to do job and earn money, right of property. So if I am older, it doesn't mean that I have to give entire my property and resources to my children and grandchildren. They have to struggle themselves and come up in their life. So the rights, like any other citizen, right to live, right to have property, right to get right to have all fundamental rights which is applicable, right to lead a dignity, life with dignity. That is the foremost the right. So all these rights we need to educate, and many times we also can ensure professional service for support. See, I have seen a person, no, I think I remember, I think Sir also remember, an architect who once, his father or somebody was suffering dementia. So he really struggled to take care because of his job, and he is in another city, parents are in another city. What he did it, he started to seek professional help, consultation with the doctors, taking service of paid, caregivers. Of course, that is another choice. That's also possibility where no family members also will be relieved, and they will be able to be little more mild or little bit polite with the caregivers. Make sure their financial and legal affairs are in order. Many times, that's another thing. So the family members also need to observe older people. Older people also need to involve the younger people also in their financial planning, because many times the financial abuse happen in such a situation when the person doesn't have enough support from their own family or friends. Because when they do not have any support, the people who are targeting, they know that this person doesn't have any support from children, doesn't have support from family. He is an isolated person. He has money, he has resources. Then a lot of financial abuse can happen. So it is always better to have a proper support system, and also better to follow no in case financial abuse happens, better to seek legal support as early as possible. Suppose if you do not have money to afford lawyers, you know that about state legal service authority is a state level agency you can approach. In Bangalore, it is near to Wilson Garden bus stand, so that they have their facility. Or else you have same facility in every district legal services authority, and they all are sensitized towards the needs of senior citizen. And even such services are available in taluka level, like taluk level legal service societies are there. You can go and tell that I'm a senior citizen, I have some legal problem, I do not have money to hire a lawyer, I need to get a free legal support, so that can be taken. And family and informal cares also should be trained, like lower the risk of committing abuse by how to get help. Like basically, the best one of the principle which we always advise our patients is taking break, or caring. The caregiver has to care themselves. Sometimes what happens, caregivers without sleep, without they do a lot of sacrifice. What happens when you do a lot of sacrifice in terms of your routine and your sleep especially, then you are likely to become aggressive and abusive, and because of the out of your frustrations, and you lack fitness, physical and mental fitness to care elderly. So it's better to take breaks, as well as you need to take yourself, take care of yourself as a caregiver. And also the such people can get support from local health and social services. One of the initiatives what NIMHANS has started, that online support group for people who are caring, uh, uh, people who are living with dementia. So in the online support group, what we thought, probably they cannot come to hospital for attending such group, self-help groups where they can share openly their problems, they can mutually learn each other. And our team members are working on that, and we will be coming out a little more very vibrant program on online support groups. Probably we welcome all of you are listening, and if you know anybody who are suffering dementia, and definitely you can recommend them also to join this program, online support group for persons living with the dementia. So VMS, Vayomanasa Sanjeevani website, you can go and log in and inform, communicate through that. or else any day you can walk into our clinic in the geriatric clinic and services and Tuesday, Wednesday, Saturday morning time. So then you can register yourself for that group. Another thing is health sector. What health sector can do? That is another thing, very important thing. So some of you are from health sector. Definitely, there are strategies. Basically, this is also program to create awareness campaigns. Please have at least a poster of elder abuse, which I have shown in the first slide, like different types of elder abuse. See, the moment I know that, okay, if I shout at my mother, it's an abuse, it's a punishable crime, then I will be careful. Better not to do, because it's a crime. So people may not be knowing the fact. They think, okay, after all, it's my mother, after all, it's my father. Whatever I want, I can tell. I'm free to tell. No, you are not free to tell. It comes under the law. You are not supposed to physically, mentally, or socially, financially. No, you are just not supposed to abuse. So this is, as a healthcare, if you can just keep a poster of this WHO poster, like different types of abuse in public places, that's a very good initiative. Caregiver support group that we have already have. We encourage into, if some of the doctors are attending this session, have such many support groups in your clinic also. Start one caregiver support group. Start one older person, senior citizen forum in your own clinic, so they themselves can have a get together at least weekly once. I've seen in Manipal Hospital and all, they have a daycare facility, and many of the activities more of like a support group. Senior citizens come together, they discuss about diet, exercise, they have some fun activities, they do some kind of exercise. So then what happens, caregiver also gets some time, and the people who are the receiving care, like older people, also will get some time to have some break. So break matters a lot. And definitely caregivers training program you can do if you are a health care provider. And definitely residential care is also a strategy. However, what happens is, in the various countries, you see 40 percentage of different countries only have some plans, and only 17 percentage of people, countries, different kind of like India, and some states have done the national survey. Of course, we have a national survey, has been done by Helpage India, and it also shows high level of this elder abuse around the world. Governments also have a key role in this regard, like to prevent the elder abuse. Before I'm going to conclude, and then we are going to have a question answer for 10-15 minutes. Just I wanted to tell that what happens really, is it because of changes in the values? No, not only that, that's not the only reason for increasing elder abuse. First of all, aging itself, like Professor P.T. Shumar sir, our team leader, used to tell, see, aging itself is a new phenomenon in India. Last 10 decades, we see more number of older population. So, first of all, we do not know how to behave with them. And since it is a nuclear family structure, even grandchildren do not know how to behave with the older population. So there is a need for promote, I know, a lot of activities to promote intergenerational bonding. So a grandchild has to understand grandparent. The adult children have to understand their parents. The grandparents have to understand their adult children, and the grandparents have to understand their grandchildren. So there is a need to understand about life. So all of them are in under a same roof, but their brain or functioning is not same. Their ability to understand a context is not same. There comes the misunderstanding, communication issues, and issues related to various other aspects. And another aspect is missing, which contributes a lot. Elderly who are having disability, like bedridden and older persons or dementia and all, many times they need a lot of support. So when you need to provide a lot of support, you may not have enough resources. So I think government also has to bring certain initiatives like palliative care model in certain few states. Lots of palliative care movements are happening. There, what they do, they involve volunteers, where volunteers will come and educate the family caregivers. Some places volunteers will provide home-based care, and then the family members will get some break. they get resources, they get chance to ventilate their emotions, where we can reduce their aggression, frustrations, which is seen in caregiving. Anyway, it was a wonderful. I think around 26 people are there in the presentation. This presentation is also available in the YouTube. Above all, we all have committed together to stand against the elder abuse. Let's start speaking. Elder abuse is an abuse. It's a crime, and it's a punishable crime. And in discussion, we will be discussing a little more about Maintenance and Welfare of Parents and Senior Citizen Act. That Act 2007 has brought many provisions. Few provisions are very powerful, like older person can go to district commissioner, DC, or revenue subdivisional head, and then give in a white paper a complaint. And if a person is suffering, and then immediately they are supposed to take action, which includes they are supposed to provide maintenance, like how the people who are divorced or separated, the spouses are eligible for getting maintenance. Parents are eligible to get a maintenance. And another thing is, we, instead of not only knowing, speaking, acting, it's also important. Sometimes we feel that okay, things are beyond, then we need to take the help of police, judiciary, because otherwise how can we tackle this issue? And see, many of these legislations and policies and programs are not to punish children. Basically, these policies and programs in India, since India government also do not have enough facility where we can take care of all senior citizens, which happens in Scandinavian countries, in Netherlands or Denmark or Switzerland. We do not have such a elaborate facilities. So these legislations are meant to sensitize children, like to tell them to, in a plain language, children, grandchildren, and son-in-laws, daughter-in-laws, tell them, see, you are legally liable, and it's a punishable crime. And if you need resources, definitely we can adjust it or arrange it, but you need to take care of your parents. That's the essence of all these legislations. Probably in question answer session, I wish to listen from you also. I just thought to open this topic for discussion. I'm very sure that you are clear about these things. If you have further doubts, definitely you can contact our team members later also. Our team is committed for the welfare of senior citizens through the various initiatives. Standing for the people who are the victims of elder abuse is one of those initiatives. Even if it happens in the old age homes also it happens. Sometimes it's because the caregivers are not trained, or number of caregivers ratio. One caregiver, 10 people. So how can they meet all individual needs? And then there happens a lot of frustration and frictions, and there is a chance for aggressive behavior. So, but we need to sensitize old age home staff also. We have started, especially in collaboration with various national and international NGOs working in this field. We also welcome you to join in part of this thing, to sensitize, just to tell, please don't do that. No, that's a crime, and we let's try to do something else to handle that difficult situation. Thank you so much. I think Gina,
Yes,
madam,
sir.
yeah, I
Thank
think
you so much, sir. It was really an informative and it was really helpful for everybody. Plus, the topic which we have taken, it's really a very good one. I would like to welcome Dr. Preeti Sinha, the additional professor of psychiatry, geriatric clinic service, NIMHANS. I would like to welcome her for the questionnaire session. On to you, ma'am.
Yeah, thanks, Gina. I'm very happy that we could take this topic in the webinar series, and I can see that a lot of people have joined, and we have panelists as with us, also Dr. Shiv Kumar and Ms. Cecil, and uh, Dr. Sojan has touched all major requirements of the things related to the elder abuse, and it's actually a very vast topic and can be a lot of pose difficulties to the elders. And I know there would have been a lot of queries in the mind of the people who have attended or who would watch this program later. Before that, one of our participants have asked things related to dementia, sleep issues with her mother. So, grandmother, sorry. So, we had a program about 2 weeks back that can be seen and sought. And we can also help in getting the evaluation if it has not been done. And because this is not exactly related to the concerns of dementia, so we may not be able to take it. Um, uh, and we have got a good compliment from one of the um, participants about the program. That's very nice of them to appreciate our efforts. A few of the questions which could be one of the from our attendees also would have thought is how to what should we do if we suspect that some older adults have been abused, as you said, either by our their dear ones or somewhere else. So what should be the first step from their side if they see that it's happening?
Thank you, ma'am.
Dr. Sojan,
So
yeah.
yes, I got the question. I think it depends on who you are. Like if I'm a doctor and in your clinic it is reported, the context is different. So you have scope for educating them, and then no certain kind of difficult behavior like sleep issues or shouting. I remember a case of mental illness where the person was the older adult was telling to the son, please divorce your wife and kill your that son. The wife was his daughter-in-law was carrying. So this elderly person was telling that carrying child is a the son of devil. Just kill, because I don't want such grandchildren. It is going to kill you. So here comes the pathological kind of things. So it needs a medical attention, and which can be sorted out through the help. So it depends on what is the problem. If it is a financial abuse, like next case, I just want to tell one son no takes away entire property, and the person after taking property they denied the care. So there comes the rights of the two persons have been denied. Right of the elderly is denied. Right of the caregiver is the other children also has been denied. So in such a situation, we need to go to the legal thing. So based on the problem, like what exactly is the problem? Physical abuse. Another case, which is scenario which I can tell, an older mother who brought the son to de-addiction center to NIMHANS, saying that every evening after drinking, he hits me and he pushes me to the wall. So what is the solution? That case still I remember. I referred to the women's helpline instead of older helpline. I sent them to women's helpline, and she went and complained. Within a week time, police brought that son to the hospital. Like very powerful tool, like women's helpline. So police went and checked, and the neighbors confirmed, yes, it happens in our the place. And this lady just called to give a call to the women's helpline, like hitting, and it's like a safety issue. So depends on the situation. We have multiple tools. The best tool for if I'm a passenger, I'm traveling by a bus, and I saw an older abuse on the road. The best tool I which recommend is 100 police. Just inform the police that this is what is happening on the street. That the elderly is being physically abused, mentally abused. It looks like a wandering person. The one good thing with the new helpline is every case is recorded and registered, and these helplines work in commissioner's office. Like if it is a district, it's a district headquarters, it happens. And once case is open over a telephone, case has to be closed. So the district head of the police, no, the in charge person will be checking what is the status, number of calls, what is the status. So now we have many options. If nothing is working in this scenario, we have senior citizen forums who can become peer educators, who can go and train and these things. And the district social welfare system also has some role in protecting the rights of senior citizens. So you have district commissioner who is in charge of entire the welfare of senior citizen at the district level. District social welfare officer is in charge. District police commissioner or the head person is in charge. District legal service authority is in charge. They can take a case by themselves if evidence is there and against such things. And you don't worry what will happen with the children. Nothing will happen. The concerned party will educate the children about the importance of the rights of senior citizen. Rather punishing, it will be more of remedial. It is more of a kind of consensus building will happen. So confidently, if you are an elderly, confidently you can approach any of these systems. If you are a non-person, you can refer this system, or you third party can complain. That's what the Maintenance and Welfare of Parents and Senior Citizen Act says. Third party can file a complaint, and they have already something called the conciliation officers already appointed in many states is there. So those people will do home visits and try to convince the children. So now we have
Thank you, Dr. Sojan.
Yes.
As you said, one of the major weapon or can be the help support, can be the legal services. We would have a webinar related to that, which would be conducted by Professor P.T. Shivkumar. But I still would request that if he can add to the advice given by Dr. Sojan in terms of where if I as a neighbor see that an older adult in next to my house is being abused emotionally, or there is a significant neglect towards him, what can I do from my side?
Yeah, thanks, Priti. I think Sojan has already highlighted some of these issues. So I think if you take Bangalore or in major cities, Elders Helpline is the best option at this point of time. And this Elders Helpline, which is either usually led by managed by an NGO, either in the district police office or in the commissioner office, it will be housed. So it works in close coordination with police. So as one of the panelists, one of the participants has highlighted, many of the designated officials may be busy in other work, so they may not be able to take it up personally and then resolve all the issues. But since an NGO is kind of leading this initiative, they will have designated people who will have to follow up and who will have to liaise with the police. They can actually call the family and then discuss. They can mediate. So there are dedicated people who are available for this. In the next few months, actually, the government of India is going to make this helpline into a national helpline in a single number. At all state level, there are going to be NGOs which are going to run this in a more integrated manner. So many of these problems, there are case scenarios or case experiences where it has been resolved and it has been helped. That has been come to know. So I think that brings the NGO as well as police into this thing, and they are authorized to actually act upon it. The other source is the legal service authority, where every district, every taluk, or even at the state level, there is a mechanism. A judge, a civil judge, actually, who is doing this kind. They have an ALSA senior citizen scheme. They implement this scheme. As part of that, they have a mandate to provide welfare and to protect the rights of the senior citizens. So if something is happening, and they use their office to report to the appropriate person and put a pressure to actually get this remedy done. So that will be another form of advocacy where they can reach out to the legal services authority. If both these things should be able to get the necessary response in most of the situations.
Thank you, Dr. Shivkumar. Already we have crossed the time, but I'll just ask Dr. Sojan again about if there are few tips you would like to give to the listeners, that how to identify especially the neglect part, whether it's the emotional neglect or other kind of neglect, and the usual physical abuse or the financial abuse. What can be the ways of knowing about it, or some tips you would like to say ki you should do or you shouldn't do when you find it, or that would be probably very helpful for the listeners.
I think neglect is the one of the common thing which is not noticed much. Easy way to identify in a way, if you see that the first thing is they leave alone. I have children, but they are not ready to take care. Leave alone. So that itself can be a first sign. And second sign is the elderly lose space. Like no, like there is a house is there, but do not give enough space for them. That also can be seen. And third thing is the people who are actively engaged in social mainstream of the society. Suddenly they actually withdraws and they focus by themselves. So there we can see that their support is coming down. It's a good sign that for us to watch what's happening. So, for example, if somebody who comes out visiting temple or be part of some forums, suddenly stops and doesn't come out, and those kind of things shows that person is lacking social support or resources, and some kind of neglect is happening. And another thing is home visits. See, many places, the ASHA, this I'm telling about rural part of India, ASHA workers are supposed to visit the senior citizens and give such kind of feedback who is being neglected. So they will be having the senior citizens who are living alone and those who are having physical health problem, how much they are seeking help, why they are not seeking help. They are supposed to maintain data. Similarly, police also. Police is supposed to do the home visit for the people who are living alone, just to ensure their safety. And what I like sir told, there is a lot of volunteering part is there, like Jana Jagrati Trust, and many such initiatives are happening where actively, like committees, they do home visits. The home visit is a very powerful tool whenever elderly living alone, and just to know that what's happening, and they will be able to report. The second part, Madam, was like physical abuse, like a physical abuse in terms of any kind of things like injuries or burn. There are cases, no, they were chained and they physically will be able to see that, no, the marks, wounds, and weight loss, all those things, no. Is it because of physical abuse, or is it because of any kind of neglect? Weight loss may be a very good sign. So above all, we need to ask, how are you, what's happening, and then tell me about yourself, how are you managing your time. So some time spending with elderly, best tool, which I am a social worker, I believe that home visit is the best tool, and visiting them. And that's the suggestion, madam. Yes.
Thank you, Dr. Sojan. I think you have told very important salient features which we should all remember. And the best is, the most important is that we should remember that it's the joint responsibility of each citizen of India that to make sure that we can prevent or can stop the abuse of elders in any form as much as possible. And this program was one of the ways of raising awareness towards it, and that's why this program will be also in the YouTube, so that people who would see later on also would get some idea. And we all welcome that if you have any issues specifically, write to us, and we would see that how we can help in addressing it, at least to some extent. And as Dr. Shiv Kumar has mentioned about the query asked by one of our listener, that our law authorities and other officials are involved in other issues related to crime and other stuff. But I think that situation is gradually changing, and things would not change in one night or in one day, and we should work towards it. And I would request all of you that when our program on the legal services come, please do watch it and put your queries. And we would have a repetition about these programs. We'll put it in some or the other ways, and it's just a beginning of addressing different issues. The next is that the next week we are coming with the different aspects of yoga, which is specifically related to the older adults. Though we had a program on holistic approach towards the aging, positive aging. This is specifically about yoga. How do we know that yoga works and what kind of yoga works? And please do come and attend it. And you can raise your query in the registration itself so that we have an idea about it. Or you can put it here in the question answer format also. And we look forward to all of you to join this program, and we would be there as a part of our geriatric clinic and services here. And otherwise we have our email ID as well and other various way to connect. Please do connect to us, and we would be happy to help you or any of your acquaintance in addressing the issues related to older adults. And I sincerely thank Dr. Sojan to give us a good overview of the problem. As the problem is vast, it cannot be just finished in 1 hour. Please do write to us query. You can put as a comment also in the YouTube or in our Vayomanasa Sanjeevani NIMHANS website, and we would address them definitely. I would request Dr. Shivkumar if he has an last ending statement before we finish the program.
I think this is something which requires a lot of social movement in terms of sensitizing public as well as the government authorities. And as we say, abuse need not be only active abuse. Neglect is something which is one of the most common forms of abuse. So there are some stakeholders like say traffic police or somebody who is working in the community. They need to be sensitized, because many times we find people with dementia wandering and then missing. And if timely if they can be identified and then they're guided and got back, they're able to be rehabilitated back to their families, lot of abuse can be prevented in that sense. Even neglecting them can be very risky for them. They can get accidents. They can it can be very dangerous for them. So and even ourselves, we'll be coming across elderly who will be perplexed, who will not be able to. We don't know as to why they are going around like that. Some of them, they will not seek help because of their cognitive abilities. So if you happen to see somebody sitting like that, if we as a volunteer can ask them and link them to helpline, I think many of the there are mechanisms in the government which can actually help and solve it. So it is not only the enforcing authorities' job; it is everybody's responsibility to do their bit so that this can be addressed. And if something is happening in front of our eyes, we need to rise up and then stand up and give a voice for that. Because the elderly, many times they may not be able to protect themselves, or they may not be able to kind of raise their voice and then withstand the person who is abusing. So it is the responsibility of everybody. So with this, I thank everybody who participated in this program today, and we please spread it across to your contacts, and so that more and more people can benefit from these awareness initiatives.
Thank you so much, sir. Thank you, everybody. Thank you, the attendees, all the panelists who have joined for our webinar. I have shared the feedback link in the chat box. You can fill that feedback form for your participation certificate. Also, you can follow us on Facebook, Instagram, and Twitter. I have shared the link in the chat box. And our next upcoming webinar is on, as Preeti ma'am have said, it's about yoga. I would like to welcome you all for that session also. Thank you so much, sir. Thank you, Preeti ma'am. Thank you, Shivkumar sir. And thank you, Sojan sir, for that wonderful presentation. It was really nice and it was really informative. Thank you, everybody. Have a good day.